Hello. So this is my presentation on biometrics and the use of wearable devices, and also reviewing blood pressure education and a specific health intervention in children and adolescents. That was done in Virginia. So basically, I started the presentation or the PowerPoint with I think one aspect that a wearable can really measure well is physical activity. Physical activity is important, as the CDC recommends 60 minutes or more daily of moderate to vigorous physical activity in children and adolescents. Um, Obviously, the lack of physical activity increases the risk of cardiovascular issues in everybody, and healthy habit formation starts in children. And then I just wanted to highlight, I think I added the chronic disease doesn't is not enough. It's not necessarily an inevitability in everyone's lives. It doesn't have to be. We can prevent it. So yes, as I stated earlier, physical activity habits are formed in childhood. Um, Self-monitoring is a very effective behavior change technique in interventions in health promotion. Um, so sort of knowledge is power, when somebody starts to analyze or look at the data themselves of their own individual activity, sometimes it can spur behavior change. Um, and then most of the research that I came across it said that when digital health technologies, wearables, Fitbits, things like that were used in uh, in tandem with like SMS apps, um, social media, especially amongst adolescents, those that tended to be make more of an impact in outcome data, meaning um, and awareness was increased usually about physical activity, and more physical activity uh, more often anyway was adopted by the adolescents and children. So as yeah, we can see that mobile apps, SMS feature can be used to motivate gamification, incentivization, um, creating competitions within, especially in school-based interventions with wearables like Fitbit, monitoring. And then when the kids also were involved in inputting their own data, or at least it can turn into a sort of a game, and that seemed to increase the usability. Um, and parents being involved as well can boost the motivation. And also, and they can do it at home as well. Parents can do it with their kids. Raising self-awareness and of personal physical activity levels, self-monitoring has been shown to be fairly um, a good tool for that. And then something else I was really interested in was that they've Quarter et al. Found that 60% of inactive adolescents reported belief that they had met the guideline of 60 minutes of moderate to vigorous physical activity per day, which is kind of, I think they can lack awareness. So once it's brought to their attention, they can make that change and at least start the process. And then just something else is it's something too important to think about is the reliability, wearability, user friendliness of and validity of the devices should definitely be assessed prior to um, measuring the outcome data. Fitbits have been used for a while, as far as I can gather. Um, So then something else I came across that I found interesting was um, partnering schools to improve hypertension awareness through community-based interventions with adolescents, predominantly, and children. But sedentary lifestyles, obesity, and poverty are all associated with an increased risk of hypertension. So, in increasing awareness, treatment, and control of hypertension in at-risk individuals, the first step would be screening, monitoring, and or education. So, in this particular intervention that I looked at, they were teaching kids how to monitor blood pressure with a device and increasing awareness of hypertension across four topics: the knowledge of blood pressure, what organ systems are impacted by hypertension, habits to maintain healthy blood pressure, and the competency in operating a blood pressure monitor. Um, and it was predominantly African American adolescents in Virginia and children. It was taught over the course of a week. There were four 1 hour classes that included video, didactic slides, workbook, interactive activities, and a group project related to heart health. And this was just some of the figures from the intervention. Um, and it seems like it could be adapted fairly easily. That's the reason why I included it. Small sample sizes, 30 and 52 respectively, the maximum number of student participants in phase one and phase two. And it sounds like they didn't have in follow-up, they some people didn't show up, which always happens. But this is just what the rubric was used to assess the students' competency in taking their measurements. And then they were reassessed at 1 week post intervention, both groups. The students' ability to recognize and define hypertension increased and improved by an average of 62%. The awareness of how hypertension affects the body increased by 92%, and competency in operating a blood pressure monitor was demonstrated by most of them, it sounds like. So and again, and increasing awareness is the main game, I suppose. So I was looking at a lot of these interventions community-based in thinking about the future of Tucson Family Food Project and with classes at Sky Island and sort of involving community and whether or not like that overlap of education and intervention in schools. I don't know if that's really applicable, but at least, in the setting of community-based participatory educational initiatives, I was thinking this might be something to think about. Um, Whether or not you would get the same group every week or, every however, but I think that could be designed, in mind. If it was like a 4 week educational initiative or intervention that focused on physical activity, blood pressure monitoring, something like that. I don't know. I was just thinking of, again, in the future of with educational initiatives and community. It doesn't, I mean, even like if you're involving adults too, like kids and parents, that can be really rewarding and in at least increasing awareness. And that would be fairly easy to measure as well. Um, okay. So again, something to end on a high note. Hypertension is the number one modifiable risk factor for cardiovascular health. Diet and exercise and blood pressure monitoring and awareness are key in improving that. So here are my references, and thank Thank you, and I will see you again.